Record now. All right, so chapter 20 is all about blood vessels. Now, you would think that being the blood vessels is not quite as important at the heart, but we'll notice that in some areas, the blood vessels itself acts like a second pump, right? So the more you, I want you to think about arteries. Arteries are more like when we look at, like like a rubber band. So when we're looking at things that kind of are similar to rubber band, what we're going to notice is that, make sure I'm not in this video. Right here. So I'm sharing it. Perfect. All right. So what do I mean by this? Now, when we're taking blood, we're usually taking blood from an actual vein, right? We seldom ever take blood from an artery. Now, let's take a look at this picture right here. Just by looking at this picture, we should be able to tell what is the artery and what is the vein. How? Simple. Arteries have really thick walls. Veins, right? It looks thick, but it's actually not very thick. Not only that, arteries are always open, right? We have lots of smooth muscle in an artery. So even if there's no blood going through an artery, there's always a little bit of an opening. So it looks pretty circular. Now, in a vein, veins without blood collapses. It is only when there's lots of blood flow going through the vein does it puff up, and now it looks like there's, like it looks like an artery. That's how big it gets nice and circular. So if you ever see bodybuilders and when they're working out, the vein pops out, right? It's one of those weird things that bodybuilders love, having those veins pop out, right? The reason why the veins pop out after they work out is because you work out that muscle, blood has to return to that muscle. And because it has to return to that muscle and back to the heart, the vein is very, very enlarged. We say it's engorged with blood, right? Because remember, the more muscle you contract or the more activity you have in that muscle due to contraction, the more energy you need, the more blood flow you need. If you have more blood flow to that muscle, you also need to get blood back to the heart again. So the veins there are very large, so then you can redirect that blood back from the muscle you just worked back to the heart. So usually when a vein has no blood in it, it is collapsed, like we see here. Arteries are always, always, always going to be open. So when we look at the vessel wall, right, we're going to have a comparison between an artery and the vein. So the tunica intima right here, we're going to see that the intima is a lining of the blood vessel. And the lining of the blood vessel, we want to be nice and slippery. We don't want anything sticking out of it, right? So if you ever look at a PVC pipe or look at a garden hose, on the inside of it, it should be very smooth on the inside. So that's exactly the kind of material we want inside. So then when water goes through that garden hose, that water goes through with minimal turbulence, right? Now, we don't have obviously any plastic in our body, but we have these very small, simple squamish epithelial cells. They're very flat. And because they're very flat, right, when we kind of make it line a blood vessel, it makes it slightly slippery. It also prevents turbulence. So endothelial cells are the simple squamish epithelial cells. Now, the endothelial cells that are simple squamish in nature is continuous, all right, with the endocardium of the heart. So anywhere where you want flow, we want smoothness. We want minimal turbulence. Instead, we want nice, easy flow. We call it laminar flow. Perfect. Now, what else do we see here? Is that with simple squamous epithelial cells, there's actually tiny gaps between them. Depending on where we are, these gaps are larger or very small, right? In areas where we don't want a lot of water to even come out, like the brain, right? We make that gap between the cells very tight. So then it's almost a waterproof seal. In areas where we want more blood or even more materials to go in and out of the blood vessel, right? Like your bone marrow. In the bone marrow, we're going to be producing large cells, white blood cells, red blood cells. How do we get it into our bloodstream? Well, how we get into bloodstream is that the capillary beds there are made out of endothelial cells with large gaps. And the gaps between the cells are so large that it allows whole cells to go through. So then we can introduce that red blood cell we just made right into circulation. If we had the same type of very tight, right, together cells that we see in the brain, right, what we're going to see is no amount of blood can get in to the bloodstream. So we want large gaps, we call fenestra, right? We call, all right, sinusoids, and it allows huge cells to even go through. Now, in terms of the endothelium, it acts as a selective permeability barrier for osmosis. At the same time, it allows small things to get in and out, right? Secretes chemicals that stimulate dilation and constriction of the vessel wall, right? Because it is so slippery, right? What we're going to see is that it normally repels blood cells and platelets. And what happens then? When it normally repels it, it usually causes it to prevent clotting. So I'm just going to add that here. Now, when things get sticky, right? And that's what happens when we need a blood clot, right? Normally, we do not want a blood clot. But what happens? You get a cut in your fingertip. As you get a cut in your fingertip, you need a little bit of blood clotting so that you don't just keep bleeding out. So what happens? Well, what happens is because you get a cut and it's deep enough to go into the endothelium, right? In other words, deep enough to cut into a capillary now, right? What occurs is that the endothelial cells that make up the capillary, they died, right? Because you cut it. And now you have collagen and all these connective tissues sticking inside. And it causes red blood cells to stick to it, causes platelets to stick to it. And now we start forming a viable clot, right? When tissues around vessels are inflamed, the endothelial cells produce cell adhesion molecules. It can induce leukocytes to adhere to the surface, increasing the likelihood of, right, white blood cell going to that area and blood clotting in that area, right? So for the test, important thing to know about the endothelium, right? Its lining of the blood vessel wall is made out of simple squamous epithelial cells. Because it's so flat and smooth, it allows you to have really good flow, right? And good blood flow is really important to prevent blood clotting. This is the reason why even if you have open heart surgery, so you are out for a couple of hours with open heart surgery, as soon as you're able to withstand the pain, all doctors and all hospitalists wants you to stand up and walk around. Because what happens? The more you lay down, the more likely you're to form clots. By moving, you're hopefully preventing blood clot formation. And nothing is as good as that kind of movement for it. Now, the tunica media right here is a middle layer. Consists of smooth muscle and elastic tissue. Right? Now, the big one being smooth muscle. The smooth muscle, especially in artery, allows us to what we call vasoconstrict or vasodilate, right? So vasomotion right here is the vasoconstriction or vasodilation that occurs when we want more blood flow to that area or less, right? So we want more blood flow to the muscles because we're working out. I'm going to vasodilate, right? The arteries that lead to that area. At the same time, there's only so much blood, right? So if I'm taking blood and redirecting it to the skeletal muscles because I'm working out, well, what's going to happen? Where do I take that blood from? You take it from the GI tract and the GU tract, right? So in the areas of the celiac trunk that we'll talk about, right? The blood vessels that goes to the GI tract, we have a slight vasoconstriction. In the areas where we are going to bring blood to the kidneys, right? The renal arteries, we have a slight vasoconstriction. So we vasoconstrict areas that are not active, and we vasodilate areas that are more active. And it's all based on like fight or flight, sympathetic, rest and digest. So when you're eating, what happens? You want to switch, right? Because you're eating, you want to digest all that food, absorb it, and bring it into your bloodstream. So then we switch, right? As we switch, we vasodilate the blood vessels going to the GI tract, And since there's so much blood only, all right, we vasoconstrict the blood vessels that leads to the skeletal muscles. So it is one of those things where we do see this kind of vasomotion, and it's caused by smooth muscle right here. So we're talking about vasomotion. It is always about the smooth muscle. Now we also have elastic tissue because in the large arteries, you're receiving a large amount of blood under a great amount of pressure, right? So your aorta is receiving blood right from the left ventricle. It's receiving a lot of blood under a lot of pressure. It needs to receive that blood without ripping, and then it needs to send it forward with recoil. So in the large vessels, we're going to have lots of elastic tissue right there. So then it can receive the blood without ripping. Now, there are times when it does rip, all right? We call it a dissecting aortic aneurysm. I had a student, she's still a student, all right? It's not her, right? So I have a student in my 201 class, right? Real smart student. And with her, she was, her dad, right? Her dad had a dissecting aortic aneurysm and somehow survived it, right? Usually you don't survive those, but he was able to kind of go to the emergency room, immediately go to the operating room. And she was very lucky because there was a cardiothoracic surgeon on call, right? And he was within like 2-3 hours, he was already in the operating room, right? And they were able to save it, right? But in the process, though, he needed a new aortic valve, right? He needed to reform the aorta, and his, heart functions are, he's alive, but, he has some issues with his heart functions now. But he survived it, right? Most people don't. Now, the tunica externa layer is one of the layers that I wouldn't, if I have a test question, it'd be about the other two, all right? So the external layer, the most important thing about this is just an external tissue layer that allows you to connect the blood vessels to the other surrounding tissue. That's it, right? Anchors a vessel, provides passage for small nerves, lymphatic vessels, and it allows you to connect it to an artery, to a vein, to a nerve, right? Now, the one thing I do want you to know is this part, vasa vasorum. Reason is we're going to see it again and again, right? The vasa vasorum are small blood vessels that supplies blood to or to the outer half of the larger vessels. So these are blood vessels for the blood vessels, right? So blood moving through an artery is moving so fast, there's no way that you can receive oxygen and nutrients from that blood. So in order to bring nutrients and oxygen to the actual material that make up your arteries, you need a separate, right, type of artery, right? A separate type of vessel called a vasa vasorum, right? So what I'd say with the vasa vasorum, it is, right? And probably the easiest way is to do it this way. I'm just going to rewrite it, right? These are capillaries that bring blood to the large vessels, right? And again, right, we're talking about, large blood vessels with very fast blood flows, right? And you're not going to receive blood oxygen, you're not going to receive nutrients when it's going that fast. So we're going to actually have separate blood vessels just for the blood vessels. And we call them the vasa vasorum. All right, here's a good picture of an artery. How can we tell an artery versus a vein, right? Look at how nice and round this is, right? Look at how kind of jaggedy and weird looking and flat this is, right? Immediately, that roundness right here tells us this is an artery of some form, right? The collapsing of this vessel tells us that this is a vein. So just by looking at it, we can tell which one is which, right? Again, vein, slightly collapsed, unless there's blood flow going through it. Right now, when we look at all the comparisons between artery and vein right here, what we'll notice is an artery and a vein has the same number of layers, right, or tunics. So an artery has a tunica intima made out of endothelial cells, right? A vein has the endothelial cells, right, and a tunica intima, right? An artery has a tunica media, but this is where the difference is. In an artery, the tunica media has a lot of smooth muscle and a little bit of elastic tissue. In a vein right here, right, we're going to see a lot of elastic tissue with not a lot of smooth muscle, right? And then the tunica externa is pretty similar in both. All right, so the differentiating point right here is that the tunica media in an artery contains lots more smooth muscle versus a vein. Now, what else do we see? In a vein, since it's not connected to the heart directly, you need some system to bring blood back to the heart against gravity. So the heart is, there's a reason why the veins of your lower legs are the most likely to become clotted, right? The reason why is because the veins of the lower legs, especially the superficial ones, right? Well, what happens is it's below the level of the heart. So gravity really makes it hard for blood to move upwards. And secondly, it's not directly attached to the heart. So you don't have a pump bringing it back to the heart then, right? So what we have instead in those veins are large valves that prevents backflow. So when you move your muscle contracts, your veins are close to those muscles, and as the muscles contracts, it squeezes the vein. As it squeezes a vein, blood moves upwards, one segment. As you relax the muscle, right, the vein then also relaxes, blood moves back down because of gravity, right? The thing is, now you have a valve there though. So as you push that blood up and then you relax, the blood falls down, but it hits a valve and closes it. All right, now I've moved that blood up one segment. All right, when you move again and contract the muscle, you squeeze a muscle, which squeezes a vein, which forces the blood up even more. And as it relaxes, it goes down a little bit, but the vein closes. So then what happens? You've moved up to another level. So the more rhythmic the contraction, the more levels you moved up, right? This is why we want movement right after we do a surgery, is that it prevents blood flow even in the lower legs. Now, arteries right here, right? Know the different types: conducting or elastic. These are the biggest one: aorta, common carotid, right? All the ones coming right from the heart, all right? All right, it's either immediately connected to the heart or indirectly connected to the heart by the aorta, but it's very close to the heart, right? Because of these, they're receiving blood under a great amount of pressure with a large volume as well. Large elastic tissue, so that you can have, right, that large elastic tissue is important. It has some, smooth muscle as well, but this large layering of elastic tissue allows you to receive that blood and not rip, right? It's like a rubber band, right? The more you stretch it, right, it doesn't rip, hopefully. Now, what happens when you stretch it though? Rubber bands want to recoil, right? So do these arteries. So when there's blood moving through right from the heart, the aorta stretches. As the aorta stretches, there's recoil now. So as the heart contracts and then relaxes, the pressure in the heart goes to zero. But that recoil of the aorta causes the blood to move forward. So then it doesn't just stay stagnant. All right. So it expands during systole, recoils during diastole, lessening fluctuations in blood pressure. Right. The second type, distributing or muscular ones, arteries, right? Distributing arteries are going to distribute blood to specific organs, right? So these are the ones that we'll talk about next week. Brachial for the arm, femoral, renal, splenic, right? These are, right, hepatic arteries, right? Gastric arteries, right? These are the arteries that have specific names going to a specific region of your body, right? Brachial, radial, right? Ulnar, that kind of stuff. Smooth muscle layer constitute 3/4 of the wall thickness. All right. They're called muscular ones because with these, now we have the ability to dilate and constrict these a little bit more. Right. Now, The last one are arterioles. That's going to be important. And, all right, and then capillaries. Arterioles are the smallest arteries. I'm going to add this on here, but most numerous. Because there's so many of them, they're important for maintenance of blood pressure. These are the ones we're trying to relax when we are trying to decrease your blood pressure, right? By giving you calcium channel blockers, beta blockers, right? We're trying to affect these arterioles so that they have slight vasodilative effect. And as they slightly vasodilate, well, there's so many of them that even if a tenth of them vasodilate, you can decrease the blood pressure tremendously. It's got a thicker tunica media in proportion to the lumen compared to even large arteries. Very little tunica externa. So again, what do we need to know about these arterioles is that there's a lot of them. And because there's a lot of them and they're pretty muscular, right? These are the ones that can cause us to have high blood pressure or low blood pressure. Right? Now, arterioles eventually leads to metarterioles, right? And capillaries, right? So metarterioles, let me see if we have a good picture here. No good picture. All right, I'll look for one. All right, so a metarteriole will eventually come out of an arteriole, and it's going to allow us to bring blood to capillary beds, right? Capillary beds are small, and what we're going to see is that, right, with capillary beds, right, they kind of spread out, right? They're very, very small, very thinly walled. It's basically the endothelium, right? And that's it. Now, with metarterioles, they're precapillary sphincters. And what we can do with these precapillary sphincters is that we can direct blood flow to specific regions. So let's say I'm working out and now I want more blood flow to the muscles. What happens, right? What happens is I'm going to vasodilate. Let's say I'm jogging. Vasodilate the muscle, the arteries that goes to the leg, right? Then I'm going to vasodilate all of the arterioles that are going to the skeletal muscles. And then, right, the arterioles are going to lead to metarterioles. And with the metarterioles, there's little sphincters that lead to capillary beds. I'm going to relax those so that my capillary beds fill up with blood. So then I can have diffusion and exchange of nutrients there, right? In areas that are not active, because I'm working out, I'm not eating. So my GI tract isn't active. So I vasoconstrict, right? The blood vessels in my GI tract. Vasoconstrict the arterioles found in the GI tract. And the capillary beds in the GI tract, well, I'm going to close up the sphincters that leads to it, right? Now, I don't want it to be completely closed because then that tissue will die. But I close it up enough that, right, I'm not really releasing enough blood in that region, right, to kind of activate it. I'm only releasing enough blood so then it can survive, right? Constriction of these sphincters reduces or shuts off blood flow through the capillaries, allowing us to divert blood to other tissues. Whoops, right? And that's a big one, right? Allowing us to divert blood to other tissues. This is the reason why, right, when you're young and you have just eaten, your mom and dad always tells you that don't exercise right after you eat, right? Is because when you're eating, what happens? You should have more blood flow, right? So then you can absorb more nutrients. But if you exercise right away, right, now where you should have blood flow to the GI tract, now you're redirecting it to the muscles. And what happens then? Well, you kind of waste the digestion and absorption, right? Right. Arterial sense organs, structures in the walls. All right. All right. I'm going to skip these. So I wouldn't ask about these. Capillaries. All right. Capillaries right here. And what I'm going to do is actually remove these because I don't want you guys to study things that we're not going to go in detail about. Capillaries are very small blood vessels, where nutrients are actually exchanged, where waste is exchanged, and hormones can pass through the blood and tissue through the walls of the blood vessel here, right? Business end of the cardiovascular system, this is where things get, brought in and taken out, right? It's basically endothelium and basal lamina. That's it. So the basement membrane and endothelial cells, right? Endothelial cells are simple squamous. They're very flat already, right? And now all we have is just a basement membrane, and then next to it is the muscle tissue, right? Or any of the organs it's feeding, right? So it's a very thin layer for gases to go through, for nutrients to go through, for carbon dioxide to go in the opposite direction, right? Capillaries are absent or scarce in tendons, ligaments, cornea, and even the lens of the eye, right? Now, again, right, capillaries are where gas and nutrient and waste exchange occurs. That's a part that I want you to know, right? So we have three main type of categories, right? We have fenestrated, right? So types of capillaries, we have continuous, and these are, I would say that these, all right, are pretty high yield stuff. I can ask you just, because they're so different from each other and locations different. I can ask 3 to 4 different questions just on these type of capillaries. So right away, you should know there's going to be at least 1 or 2 questions on these. Continuous capillaries. What do I want you to know? Right? Contains tight junctions, forming a continuous tube with small intercellular cleft, right? So very small gaps are found between the cells, all right? This kind of a continuous capillaries allows passage of only solutes like glucose to go through, right? Parasites wrap around the capillaries and contain the same contractile protein as muscles, contracting and regulating blood flow here. Right now, with these right here, right, they're found in the brain and spinal cord. All right, with these, very little movement of materials occur. Right, so proteins, small proteins cannot get through. Right, so again, what we're going to see is with these capillaries, continuous ones, very tight junctions, right? Very small things can get in and out, solutes, gases, that's about it, right? Fats, because the cells are made of fats. That's about it, right? So you're not going to find these continuous capillaries in the liver where you're producing albumin, right? Because it's just too big. Right? You can't introduce a whole protein if you have continuous capillaries there, right? You need holes in the capillaries so then you can introduce things. Now, the second type, fenestrated capillaries, are found in the kidneys and the small intestines, right? These are organs that require rapid absorption and filtration, right? They have fenestra right here in the endothelial cells. So the fenestra are like tiny windows that are found inside the cell, right? So the fenestra allows things to get in pretty easily now. So then when we have glucose, right, amino acids that we're absorbing in the GI tract, right, it can go right through into the blood vessels, into our bloodstream, and we don't have to wait for active transport, right? Allows passage of only small molecules like, right, peptides and very small proteins. Right? So there are larger gaps here that allows even small proteins to get through. Before it was just glucose and gases. That's about it. And a little bit of hormones, right? Now these are like larger gaps. We can allow small proteins in. And the largest ones are the sinusoids. right? We see the sinusoids in areas where, right, where we're going to have introduction of large proteins or whole cells. So we see it in the liver, bone marrow, and spleen, right? Bone marrow, we're going to be producing all the cells. Spleen will be removing red blood cells that are old. Liver, we're producing a lot of albumins, right? So what we're going to see is that these sinusoids contains huge openings between them, allowing large materials to go from where the area of production, red bone marrow, right? Then you can place it into the bloodstream because the capillaries there contain such large gaps that we call sinusoids, right? Allows large proteins, clotting factors, and cells even to enter the circulation. So again, three types. Continuous contains tight junctions. You have tight control over what gets in and out, right? Glucose and solutes, a little bit of water follows, and that's it. As we go to the fenestrated one, now we have less tight junctions, more gaps or clefts, and then we also have windows within the cells themselves, allowing small proteins, right? Amino acids, dipeptides, tripeptides to go in, right? Sinusoids are capillaries, blood vessels that contains large gaps between the cells, large windows within the cell. And what happened is we find it in the liver, bone marrow, and spleen where we're introducing either whole cells, like a red or white blood cell, we're removing whole cells, like in the spleen, or we're introducing a large protein like albumin, right? Now, in terms of capillary beds, right? Capillaries are organized into networks called capillary beds, and I'll show you a picture at the break, right? And with the capillary beds, when the capillary sphincters are open, we can perfuse. When the sphincters are open right here, there's going to be increased perfusion of the beds and increased nutrient and waste exchange. Right? So the sphincters are important, right? If you open it up, you bring blood to the capillary beds. The beds will then lie right next to the cells we want to supply. So as you have more blood going to those beds, we can bring nutrients to that area. We can take waste out of that area. Right. When the sphincters are closed, we can bypass. Oh, this is a good one right here, right? So when open, figure out what happens. We just mentioned. When closed, what happens? Right? We bypass the capillaries. And by bypassing it, now we're saving all the nutrients for elsewhere then, right? Because we didn't give away the glucose to that region, now we can send it to regions that are more active. So then we have lots more flow, more nutrient flow to the more active regions. Right, this is crazy. 3/4 of the body's capillaries are shut at any given time. All right, couple one of these are pretty cool. Let me see, there's another one. Sorry, trying to look for some of these. All right, veins right here. When we look at veins at rest right here, right? At rest, take a look, right? This is how much blood in a specific area. So in the heart, 12%, right? In the pulmonary circulation, 18%, right? In arteries, only 11%. So at any one time, blood is not found in the arteries, capillaries, right? Or even in the heart. Most of the blood is found in the veins, right? And when you start working out, what happens is the veins start to bring that blood that's stuck there, right? Now you're starting to work out. Now you have more muscle contraction. Now you have more activation of this pump that brings blood upwards towards the heart, right? The contraction of the muscle squeezes the veins, causing that blood to move up, right? Then as the muscle relaxes, the valves close, the blood then moves up one segment, right? The next contraction, blood moves up to the next segment. As the muscle contracts, it closes the valve. Now I've moved up another segment. And with more rhythmic contractions, I move up segment to segment, right? So then when we're exercising, we're having lots of rhythmic contractions, right? So I'm moving this 54% of the blood that's stuck in the veins, I'm moving it up towards the heart now. And now I can have what we call increased venous return, right? I can really increase the amount of blood I'm giving away, which is great, right? So veins are greater capacity for blood containment, got thinner walls, less muscular and elastic tissue. They collapse when empty, right? And expands easily, right? They're subjected to pretty low pressure, 10 millimeters of mercury. Not enough to move blood against gravity. That's why we need the muscles to work, right? Now, the smallest veins are kind of the veins that lead up from the capillary. They're porous, so then we can have increased fluid exchange. By the way, why is this important? This is how we get edema, right? Do you guys ever, like when you're at work and you have to stand for a long period of time? Or even if you're at school and you're just sitting for a long period of time, right? When you get home, what happens is your legs might look swollen, right? Now, you guys are young. You probably don't have that, right? Enjoy it while you can, right? Because, yeah, eventually, I hate to bring it to you, you'll get old too, right? So what happens is when you're young, you don't think about it. But when you get older, you get home, you're like, wait, why's my foot so swollen, right? And it's because of these post-capillary venules. Because as we're sitting in class, we're not exercising. We're not mobilizing the blood in our lower legs, right? So what happens? The blood that goes into the capillaries, now it's trapped in the veins on the other side of the capillaries, and it starts to swell the veins. All right. The post-capillary venules start to swell, and there are large openings there. So lots of water can leak out, right? And now we have edema. Sucks. All right. Now, what else? Muscular veins have one or two layers of smooth muscle and a thin tunica media, right? What I want you to know are when we start seeing valves. Medium-sized veins are when we start seeing valves, right? The tunica intima of these medium-sized veins and anything larger than them, right? We're going to have these venous valves. And remember, valves, it doesn't matter what kind of valve, right? Like I mentioned last week, all valves prevent backflow. So the last thing we want it to do is to contract the muscles of the legs, have that blood move up, and then the valve be leaky, and all that blood that's supposed to move up one segment now starts to leak back down, right? That's not good. That can lead to what we call varicose veins, right? Anybody have moms or dads with varicose veins, right? It sucks, right? The reason why it sucks is there's no real good treatment. So with varicose veins, usually it happens to the very superficial veins we'll talk about next week, right? Those veins are superficial. They're on the skin. Why is that important? They're away from the muscles, right? The deeper veins of the legs, right? Those deep veins, like your tibial, fibular veins, right? They're next to muscles. So when the muscles contract, it can move blood upwards against gravity. But the superficial ones are like on the skin, right? So what happens? Even when you are walking and you're contracting the muscles, those superficial veins are too far away from the muscular contraction. So you can't bring blood easily upwards then because it's so far away. It's not really, right, sensing that tension from the muscular contraction, right? So what happens? Blood just sits there, right? So those veins are more likely to form blood clots. And more importantly, because it sits there, it starts stripping the valves there, right? As it starts stripping the valves there, right? Even when we want blood flow to happen, it doesn't happen. And the vein starts to engorge with blood all the time, right? That's what we call a varicose vein, right? And it's usually due to failure of these venous valves. All right. Again, normally the skeletal muscle contraction allows you to move blood upwards. Now we call it the skeletal muscle pump, right? This is the reason why, if you've ever seen fighter pilots before, right? When you're a fighter pilot, right, there's a high likelihood that you might pass out if you don't have blood flow to the brain. So what do? Well, they wear really tight suits, right? They're fighter suits. In their legs right there, right? They have little valves, they have little like air compressors there, right? So what happens is when they're flying, right, they're going against 3, 4 times normal gravity. So it squeezes the legs, their suit. As it squeezes the legs, it causes their blood that's now pooling in their lower legs. It squeezes and it causes blood to move back towards the heart. So then they don't pass out from lack of blood flow, right? Now, if you've ever been in an operating room, right? What happens is they'll also put what looks like little bladders on somebody's lower legs. The little bladders that they put in are going to be connected to a pump, an air pump. And if that person's going to be in surgery for more than 1 or 2 hours, right? What happens is blood clots can form because when you're in surgery, not only do I put you to sleep in general anesthesia, but the unspoken thing is I also paralyze you, right? I give you a paralytic, right? So the last thing I want you to do when you're asleep is to move. So I don't want you to be moving, so I paralyze your whole body. And because I'm paralyzing all the skeletal muscles, your diaphragm can't move. So I have to intubate you, right? All because we don't want you to move, right? Now, because you're not moving, blood's not moving in your legs as well. So that bladder will then compress your legs, forcing blood back towards the heart. So then hopefully you don't get blood clots. All right. So it acts like a skeletal muscle pump, that bladder that we put on your legs. Right. We call it TENS unit. All right. Larger veins. Oh, right. Larger veins and venous sinuses. Venous sinuses are very low pressure, right? Veins with especially thin wall and very low pressure. Right. We see it in the heart. We see it in, whoops. All right. We see it in the heart and we see it in the brain, right? Veins with especially thin walls, large lumens, no smooth muscle. Very low pressure then because there's no smooth muscle, right? With these large veins right here, right, it allows us to bring a lot of blood through, right? Blood from different veins will drain into venous sinuses. So then eventually you can drain it back to the heart. So these venous sinuses, very important for that. All right. So large veins, what do you need to know? Contain some smooth muscle in all three tunics, right? Thick tunica, thick tunica externa. And examples of these are the vena cava, superior and inferior, which we'll talk about, the large veins that are connected to the heart, internal jugular vein, pulmonary veins, right? Now, for the most part, I would only ask about some of the differences between arteries and veins, right? And which veins has those actual valves, right? And how the valves work. All right. This is cool. All right. The simplest route and most common route of blood flow is simple, right? Blood goes out the left ventricle, through the aorta, all right, through, all right, all the way down into, all right, our target muscular artery, right? So if we go into the brain, it's going to go into the common carotid, it's going to go through the internal carotid artery, and then it goes into the brain, right? Then that blood is going to go through an arterial and then into a capillary bed. So this is a capillary bed right here, right? As we hit the arterial into capillary bed, all right, this is where we are going to have gas exchange, nutrient exchange. So the blood that exits out on this side right here is going to have less oxygen and less glucose. Then it's going to go back to the heart, so then we can direct it back to the lungs to fill up oxygen, right? Now, right, what happens? Easy, right? It goes artery, arterial, capillary, veins, back to the heart, right? Now, what we're going to see is there is a second, all right, system that we call the portal system. And it's pretty interesting. And we already started talking about it a little bit. And now we're going to talk about it and give it names, right? I'm going to write this down that this is our hepatic These are the two I want you to know, right? And why are these portal systems so important? Simple, right? Portal systems allows us to communicate to organs directly, right? And then blood returns back to the heart. Now, example of this, right? Hypothalamus and the anterior pituitary. You guys saw how small the hypothalamus is, right? How much of your cardiac output do you think goes to that small area of your brain? Very little of it, right? So if we talk about your heart, ejecting maybe, right, having a cardiac output of maybe, 5, 6 liters per minute, right? Maybe 1 liter of it goes to the brain, right? For the whole entirety of the brain. Now we're going to have blood go right to the hypothalamus, a very small part of the brain, right? Maybe 5% of that liter goes to the hypothalamus, right? So hypothalamus then is going to release a lot of hormones that stimulates the pituitary gland. So if I would have the hypothalamus secrete those hormones, right here's the hypothalamus, right? Now it receives that 5% of the blood and it secretes all those hormones right here. What are the chances that the hormones goes back to the heart, redirect all those hormones back to the brain, and now just goes to the pituitary gland, right? Very small, very small, right? In other words, there's no way, even though they're very close to each other, right? There's no way you can have enough efficiency where we can have this normal, simple pathway where we have the hypothalamus receiving blood, then it's going to release hormones that will stimulate the pituitary, right? As you release those hormones, all those hormones have to go back to the heart first and then to the brain again, and then somehow make it to the pituitary gland, right? So you're going to lose a lot of your hormone signals. So, what is the best way of connecting those two organs so then you don't lose any of the signals? You connect it by a portal system, right? By connected to a portal system is this: blood goes to the first capillary found in the hypothalamus, right? The first capillary bed right here in the hypothalamus. Now we're going to secrete all those hormones in the hypothalamus, and the blood then goes directly into the pituitary first, right? So all the hormones released by the hypothalamus into the bloodstream, right? Well, that blood goes to the pituitary next. So the pituitary gland is going to receive 100% of the hormones, right? And then we return blood back to the heart, right? What we see here is this, right? Blood flows through 2 consecutive capillary beds on 2 different organs before returning back to the heart, right? Again, right? It allows us to have increased efficiency, or what we call efficacy, of our signal, all right? By having blood go to one capillary bed in one organ, and then that blood, instead of going back to the heart right away, it goes to a second capillary bed in a second organ. Well, that second organ is going to receive all that blood from the first one, right? If that blood contains a lot of hormones, it receives all those hormones. Perfect, right? It's exactly what we want, right? We also see it in the intestines and the liver, right? The liver does a great job of receiving nutrients and then packaging it and storing it. So then you can live when you're fasting, right? Or even when you're starving, right? Perfect. So if the liver is that important for storage of our nutrients, shouldn't the liver get the first dibs, right? Get the first amount of, you know, nutrients when we eat? It should, right? Because it's so important in kind of making all of our storage proteins, storage carbohydrates. So that's what we see in the liver and in the intestines, right? When we eat, right, what we're going to see when we eat is that blood is going to go into your superior and inferior mesenteric arteries, into the arterioles there, and into the capillaries of your GI tract, right? Since you're digesting and absorbing, all the glucose goes into the bloodstream. All the amino acids goes into the bloodstream right here, right? Then the hepatic portal vein takes all that blood full with all the nutrients directly to the liver, right? Then the liver receives all that blood, right? Directly, right? And it's got the first chance of doing something with the nutrients, right? So it receives galactose that we just absorb. We can absorb galactose. The liver takes that galactose, turns it into glucose. It takes the fructose that we eat from fruit, right? We absorb that fructose. It goes through the hepatic portal vein right here, goes to the liver. The liver converts the fructose to glucose as well, right? So it allows us to change things and to store things, right? Now, this is why it's so important, right? This is also the reason why when people have colorectal cancer, where's the first region we look at to see if there's metastasis? The liver, right? The liver is almost always the first organ that we see that contains metastatic colorectal, right, pockets. Because when you have a metastatic cancer and it's coming from the colon, right, well, those cancer cells move through the bloodstream, through the hepatic portal vein, and also seeds in the liver then, right? Right, the last one that we'll talk, well, not one of the last ones, right, that we'll talk about are anastomoses, right? Anastomoses are where two blood vessels meet. So here's an anastomoses right here, right? Arterial anastomoses are the most important thing. I remember, right, when I was doing my trauma rotations, trauma surgery rotations, right? The trauma surgeon would always say, right at the end of our day, before you go to bed, pray that you have a lot of anastomoses. I'm like, that's what you talk about, right? So yes, anastomoses are the reason why you can have one person have a myocardial infarct in one part of one artery, right? That one person survives and really has no effect. But a second person has the same infarct in the same region of that artery, and that person either dies or, right, will never be the same again, right? Are these kind of anastomoses right here allows us to redirect blood flow. So let's say you have a blood clot right here, right? Without an anastomosis, what happens? Right? You have a blood clot right here, there's no blood going through. You're screwed, right? That's going to be a major issue. Now, what happens if you have a blood clot right here, but you have all these anastomoses, right? What happens is that you can have redirection of blood flow away from that clotted area, right? It mitigates the damage you might have had. So the more anastomosis we have, the more mitigation, the more lessening of the issue, right? That's much better, right? Now I have a real world circumstance with my sister, right? My sister at the height of COVID had a mild stroke, right? And what happened was it was mild stroke. She had slight paralysis in her right leg. She had slightly slurred speech, but we could understand her, right? Then in the hospital, she had a massive stroke, right? What happened was that because she did not have arterial anastomosis, right, found on the anterior cerebral artery, what happened with her was that that blood clot there, right, became a huge issue, right? If we had our anastomosis there, we can redirect blood away and mitigate and lessening the signs. But for her, she didn't have the actual anastomosis. So all blood ceased to go through. So she had permanent damage in the frontal lobe. She can't talk, right? Even now, it's been like 3.5 years. So her Broca's area, right, is completely obliterated, right? She understands, right? Everything. So her Wernicke's area in the temporal lobe, you might see it in the test coming up, right? I would know it, right? So in Broca's and Wernicke's area, well, her Broca's is affected. She can't speak, even though her Wernicke's is unaffected. She can understand, all right, all the, like 3, 4 different dialects of Chinese. She can understand when we talk to her in English. She can understand when we talk to her in Indonesian, right? She understands all those languages, but she cannot speak. And it's incredibly frustrating, right, because of it. Right? If she had those anastomoses, it would really have mitigated it. Now I know this because I talked to, right, an interventional neurologist, right? When I got the results, and she was like, "Yeah, you'd think it'd be like you have a myocardial infarct and you can do a balloon angioplasty, right?" Well, the problem is the blood vessels are so fragile in the brain that the needle, the guided needle that we use with the wire, right, it could perforate through right away, right? So you have to be very careful about doing that kind of stuff with the arteries in the brain. Right. So arterial anastomoses are almost always good. They provide collateral circulation, right? Now, venous anastomoses are okay, right? Again, if you have a blocked vein, it hurts. You have a blood clot there, right? But remember, this is after you've given blood, right? You've given nutrients to that target area. So you're not affecting the actual blood going in to the right tissue at that point. We're just affecting blood exiting. So you have pain, you have edema, that kind of stuff, but you don't usually have a immediate life-threatening condition from it, right? So know what an arterial anastomosis is and why it's important. All right, mechanism of venous return. Venous return is just blood flow back to the heart right here, right? Now with venous return, blood pressure is the most important force in venous return, right? Gravity drains blood from the head and neck region, right? Helping us return blood from the head, neck, and brain region. But, right, in the areas below the heart, we need these pumps to help, right? And we kind of mentioned it already, so I'm not going to mention it again, right? But I'm going to highlight it so you can see what it does and what I expect you to know from it. All right. Now, the second part right here is also equally important. All right. So we have a skeletal muscle pump that allows us to bring blood from the lower limbs. All right. You contract the muscles, blood forces is ejected upwards in the vein. As you relax the muscle, the blood comes down, but there's a valve in the way. Right. So the valve prevents that blood from going all the way back down. Right. Now, we have this rhythmic contraction. And with each contraction, blood moves up in stages, right? From your lower leg to your mid lower leg to your right upper leg, all the way up to your upper thigh, right? Blood moves by way of the skeletal muscle pump. Once it goes into your abdomen, right? We have a large blood vessel called the abdominal aorta, right? In the abdominal aorta, there's no real muscle next to it at that point, right? Your rectus abdominis, your transverse abdominis, it's present, but your abdominal aorta is so deep that you can't really use those muscles to eject blood up. So instead, we have what's called a respiratory pump. All right. The respiratory pump is basically deep breaths, right? When you take a deep breath, what happens? Right? Your thorax increases in size. Your abdomen decreases in size, right? I'm going to write something here, right? Called Boyle's Law. Anybody's ever heard of Boyle's Law? Right? We see it in physics. We see it in, right, chemistry as well. It's how pressure is related to volume. Right? What do I mean? Right? Boyle's Law says that, and the best example of this is with maybe a propane tank that we use to barbecue, right? When you have want to barbecue, right? You get 10 gallons of propane and you put it in a 10-gallon tank, right? What happens? When you open up the spigot, well, there's 10 gallons. So there's a lot of air, there's a lot of propane that comes out under a lot of pressure, right? Now, what happens if you get that same amount of propane, 10 gallons, but now I put it into a much bigger tank with a larger volume, 100, right, gallon tank, right? What happens is that the same amount of, I didn't change the amount of gas, right? It's still, right, 10 gallons or 10 PSIs, but now I just put it in a larger holding tank, right? What happens when you open this spigot, right? Less pressure comes out right away, right? This is Boyle's law. As we put gas into a larger tank, right, the gas has a decrease in pressure. Now we see this in our body all the time, right? As we take a deep breath in, your thorax increases in size, right? Your lungs increases in size. There's a pressure drop in your thorax, right? So now there's less pressure up here. At the same time, as you take a deep breath, right, your rectus abdominis, your transverse abdominis muscle kind of squeezes your abdomen, right, making your abdomen smaller. All right. Again, volume and pressure are inverse. So if the volume of the abdomen is decreased, the pressure in the abdomen increases. So there's more pressure in the abdomen than there is in the thorax, right? It causes blood to move from your abdomen up into your thorax, right? We call that the thoracic or respiratory pump, right? This is why you will see fighter pilots, right, take deep breaths and slowly breathe out, right? So that they can activate this thoracic pump, right? Now, as a result of it, we have cardiac suctioning, which allows us to then bring blood even faster into the heart from the abdominal aorta. And here's just a skeletal muscle pump right here, showing how it works, right? When you contract the muscle, right, blood is ejected up. When you relax, blood goes down a little bit, but there's a valve in the way, right? So it doesn't go all the way down. Right. Now, the rest of the chapter is all about going through the arteries and veins. Again, that'll be part of what we will go through next week, all right? As we look at the arteries, veins, heart, all right? So there's nothing I would talk about in the rest of this chapter. Any questions? All right, let me stop here. Pause.